How does cancer treatments or brain tumor treatments or multimodal brain tumor therapies influence brain function? And there are a couple of ways of breaking this up. I'm going to use the context of glioma as an example, as a central theme and example for the purposes of this talk. Some of these principles also apply for patients with brain metastasis, and some also apply for meningiomas, but the classic intrinsic brain tumor that changes how the brain works is really glioma. So we'll talk about everything glioma-centric. So glioma-related functional changes in the brain are thought to occur in the setting of a couple of instances. First, we know that both low and high-grade gliomas infiltrate or invade into the cortex or the surface of the brain and the subcortical regions, the undersurface of the brain. We know that lesions treated during surgery to remove the tumor, call it cytoreduction, so tumor surgery removal, also create changes in the brain, change the way the brain processes information. And third, we know that our therapeutic interventions, such as chemotherapy and radiation, also influence how the brain functions and works. So I think of them, broadly speaking, as tumor-related brain changes or plasticity and treatment-related changes, and we'll dive into that a little bit more. Over the past 30 years, there's been a growing body of evidence demonstrating that many patients, even systemic cancer, without even having an intrinsic brain tumor, just breast cancer, for example, have cancer-related cognitive impairments. That's the term we use, CRCI. This involves deficits or changes in language, learning, attention, processing speed, any of these domains outside of that which you would expect as the normal effects of aging. And it's increasingly observed among long-term cancer survivors or brain tumor survivors or any cancer survivors. Traditionally, cancer-related cognitive impairments and symptoms were thought to be caused by the neurotoxic effects of chemotherapy alone. Therefore, we use the term chemobrain or chemo-related cognitive impairment, or brain fog is another term that was used. However, several related observations have been found that's opened up this definition quite a bit more. And we have them listed here. First, we know that cancer-related cognitive impairments, or just cognitive impairments in general in the setting of brain tumor, causes a pro-inflammatory, increased inflammation in the central nervous system, particularly in the brain. This systemic inflammatory response is really what makes some cells turn off and not work as well. You can see that with results of chemotherapy. You can also see it with other types of immune treatments for the brain. We know that these changes are associated with a depletion or getting rid of these progenitor cells, these cells that are there to make other cells and be the healthy turnover. So when a certain cell dies, it makes a new one, right? These progenitor cells that are waiting in the wings to make a new healthy differentiated cell for a function in the brain, those cells die off as a result of cancer and cancer treatments. We know that there are neurotoxic effects of chemotherapy and radiation on mature cells, not just the progenitor cells. We know that often as a result of treatment, you can have white matter injury, you can have white matter changes. White matter is really the scaffold, the structure where the network information transitions itself from one part of the brain to the other. And you see changes in that white matter. It becomes less robust, less thick because of all these processes. And we know, generally speaking, that there's a loss of connectivity across regions of the brain, both at the cortical level, the surface part, and then the subcortical regions as well. So brain-related changes from having a brain tumor can take a couple of different forms. You can have local changes, meaning in the tumor itself. You can have local hemispheric changes, meaning changes in the general area in the neighborhood. And then you can have opposite hemisphere changes that are really fascinating and increasingly understood that we'll talk about in a few minutes as well. And we know that when gliomas are situated within functional regions of the brain, normal processes such as language may be disrupted. And so unlike in stroke models of aphasia, right, where you have a sudden onset stroke and it kills a bunch of cells, and those cells, that whole area of the brain doesn't work as well, we know that in the setting of glioma, there are glioma-related changes that cause a reorganization in the brain. So in this example here, you can see for a patient who's going to the operating room for surgery, normally this area right here that I'm outlining would be the area of the brain responsible for movement. But we also see here that this region of the brain, this whole region here, was involved with tumor, And you see that what happened over time is that the brain reorganized so that this sensory region of the brain took over that function. So you can see that this points 1 and 2 really became the regions for hand function where it should be here. So this was a reorganization or a neuroplasticity response from having a tumor in the brain for many years. The brain itself had reorganized to figure out a new way to get motor responses from a group of neurons to make your hand move in the setting of having a tumor there that wasn't supposed to be there. And so these are local intratumoral changes that maintain function in the setting of having a brain tumor. And these functions are important considerations for brain tumor surgeons when we're trying to remove a tumor and you want to remove it as safely as possible.